Well, I'm Dr. Mike Milligan. We're here at the Chicago Midwinter Meeting. That's the background noise. I'm here with Dr. Rod Kurthy. We spoke about his whitening earlier, and so that's on other areas of our site. But Rod does a number of things in dentistry. He's an innovator, and he's done so much for dentistry. You've really got to get to know Rod. So, Rod, what are some of the other things that you've given to dentistry, books you've written, techniques you've developed, things of that nature?
Well, gee, I've been involved in clinical type of research, practical type of things for, gosh, about 34 years. I was still in dental school when I started. Yeah. My first whitening participation in a whitening study was 32 years ago. Wow. And my first Perio was about 34 years ago. Yeah. I've been a big student of marketing, because I was kind of brought up early in my career with a company, a very progressive company, where I learned the business of dentistry. Great. You know, I love the clinical end of it, but the way to get patients in, you know, just because you're a great dentist doesn't mean you're going to have a great practice. Right. Because if you don't know the business end of it, if you don't know the marketing end of it, how are people going to know that you're so great?
You know, it's so true. It's so important to be clinically excellent, and Rod is. And so in school, that's really all we learn. We don't get any of the business side of it. They're so busy teaching us the clinical side of it. Courses then after dental school to learn the clinical side of it. But actually, once you're in practice, about 85% of your success in practice is the communication skills and the management skills of your staff and all these relationship-based things.
That is right.
So, Rod, go ahead and tell us about that then.
Well, you know, early in my career, as I said, I was with this company and I learned some very basics in marketing. And I saw the results. Now, when I moved back home to Southern California and started my own practice, because I had been a junior partner in that organization, I followed the same techniques and it worked great. But you know, the public, they mature. And you know that famous term that everyone uses nowadays. Well, nowadays is always changing. And so things that I used back then just all of a sudden just didn't work as well. And so I started learning more and more and more about that, and I was attending a lot of courses, things like that, and so many of the professionals out there that do marketing for dentists, they think we sell tires or something, because they market us in the same way. The same old you know, guidelines for other types of business just don't apply to dentistry. You know, we want.
I agree. We want to look professional. And people are looking for something different than a tire salesman.
We don't want the tire kickers. We don't want the looky-loos. We don't want the people that come to us just because of a freebie in marketing. We want good patients. And my definition of a good patient is a patient that will come in to my office, be respectful of my staff and I. They'll listen to me. They'll take my suggestions. They'll book appointments. They'll show up for their appointments. They'll pay for them, and they'll refer other people like that.
And they'll appreciate it.
That is what I call a good patient. Now, if you were to survey 100 good patients like I just described, and if you asked, one of the questions you said was, would you ever pick a dentist through advertising? They'd all say no, because they care too much. You know, they'd say, no, I'd find a dentist some other way. So the bottom line is, when you're marketing, you have to get around that. You have to be so effective and so believable that they forget it's a marketing piece and they just get caught up in it and they pick up the phone and call you.
How do you do that?
Oh my God, that's well. You asked me about books. I've written 2 books on that.
Written 2 books
on that subject. But in marketing, credibility is king. You can say anything you want. They're not going to believe you. Dentists think because they've got a doctor, a DR in front of their name, that people are going to believe them. That's not true. So the whole idea is that you have to establish credibility, believability, and impress the patients right from the front of whatever it is they're going to see. And you weave it right on through, so that every word you say, they believe. And there's ways to do that. It takes some time, but that's one area that I've been very, very involved with, and a lot of things I developed with my very good friend Howie Horrocks. You know Howie, right? Howie owns New Patients Incorporated. And when Howie and I got together years ago, he was the marketing professional for dentistry but he'd never spent time in a dental office.
Okay.
So there were things that he didn't really understand. I was the marketing type of dentist, and I was always looking to see how patients responded to different things.
Sure.
But I wasn't a marketing professional, so I didn't know that much what to do with it. But when we got together, oh my goodness, Howie used to fly down from Seattle to Southern California, and we'd spend 3 days at a time brainstorming and testing and all kinds of things. So it was Howie actually who talked me into writing my two books. And between the two of us, we just came up with some great things. But other things, one of the things that I'm asked to lecture on quite frequently now is diode lasers.
Right, you were one of the early ones, and you wrote a book on lasers.
I've actually written two. Well, one's called Rod Help. Should I really get a laser and teach me how to make money with my laser? Because too many dentists buy lasers and they just don't know what to do with them. They just sit there and gather dust. And there's so much you can do. So one of my books is about what you can do. It's not a clinical technique, because you can get the techniques in other places, but it's how to utilize it to the benefit of your patients, to the benefit of your practice, all kinds of new things that you can be doing. The other one, which I think you might have, is my Perio protocol.
I've got that one too.
And because I've been involved. I've been involved in Perio for, like I said, 34 years, and I don't do surgery anymore. One of the things one of my pet peeves is the way that most continuing education folks out there teaching people how to use their diodes, the way they're teaching to use a diode for Perio, I just think is ridiculous. This go in now and go back in a week later and go back in. I came from the surgical end of it. You don't do surgery and then go back in a week. If you're going to do bone regeneration surgery, you don't go back in for at least 9 months. You put a sticker in your chart telling your hygienist, stay away. And so why is it that when you use a laser, you don't think the same way? Well, I think that's the way you should do it. It should be a definitive treatment where you're trying to get true attachment, not just a long junctional epithelial adherence. And there are ways to do that. And so that particular book, my Perio protocol, is about how to use the diode laser, which is nowadays very, very inexpensive, to treat Perio definitively and get bone regeneration and true attachment and things like that.
These books, would they be available through your website?
Oh, sure. They're at the Evolve Dental Technologies website, which right now is www.korewhitening.com, and Kor is K-O-R, yes.
Korewhitening.com.
Yes. So that's where they are.
He's got all the energy in the world. He's done amazing things for dentists. You really need to get to know Rod Kurthy and utilize his products. Take a look at korewhitening.com. Rod, thanks so much.
Thanks, Mike.
Great.
Nice talking to you.
Great.